the best medical care possible is of paramount importance to most Americans these days, but where to get it is what many find so perplexing. Here in the state of Florida, there are a number of outstanding medical facilities. Most prominently are those located in the cities of Miami and Gainesville. But what you may find surprising is that for the residents here in northwest Broward County, they have right in their own backyard one of the most advanced, state-of-the-art hospital facilities anywhere in the country. It is this, the Northwest Medical Center, located here in Margate. Founded over 20 years ago, this facility has grown to the point where it has some 215 beds, a staff of over 800 medical professionals, and some 600 doctors affiliated with this facility, practicing and treating some very unique medical specialties. To learn more about this organization, we sat down with their Chief Executive Officer, Lynn Swartz.
Northwest is a great family community hospital in the northwest section of Broward County. We were recently awarded, actually 2 years running, we received the President's Award within our company for providing great patient satisfaction, great physician satisfaction, and great employee satisfaction. They in turn gave us money, and we, the employees, really said, what do we want to do with the money? It's our money. So together we created a gym. We bought a van. I mean, we've done things that are really only for the employees, and they love it. So they have their own workout gym. While we're here, we're going to have a good time, but we're also going to take great care of patients. We give them an opportunity to learn, to grow, to advance. Together, we're in this together, and I'll stick by them. I'm with them all the way. And I'm really, very grateful for the staff that we have, grateful for the management team. Everybody works for the same thing, and that's to take good care of patients.
What we have here, Doug, is an interventional pain clinic. The word interventional implies the use of procedures. Interventional pain medicine is the branch of medicine that uses various procedures in order to diagnose and treat a wide variety of chronic pain disorders.
Wound Healing Center is basically a part of the hospital that creates a multidisciplinary approach to healing very resistant wounds. What I mean by resistant wounds are wounds that are delayed in their healing. And often they're delayed in healing because patients have underlying diseases like diabetes and peripheral vascular disease, heart disease. Very often they're on dialysis, they have kidney disease. And of course this makes wound healing very difficult.
This department is the Department of Gynecologic Oncology. What it is all about is to identify and treat cancers that arise from the women reproductive tract.
There are multiple sleep problems. Most common we see is sleep apnea, but there are a lot of other sleep disorders too, which includes insomnia, narcolepsy, periodic leg movement syndrome, restless leg syndrome. So we as a sleep specialists, we see the patients with multiple problems. Based on that, when we do the sleep testing.
The Pain Center has been up and running for a few years now, and it is served by physicians who generally are anesthesiologists by training. They go on to get additional training in pain management. Patients who have chronic pain for a variety of different reasons come to the Pain Management Center to learn about their pain and then to undergo procedures or techniques that will help minimize their pain. It offers them an alternative way to treat that pain and hopefully alleviate it. And those physicians are very dedicated and very concerned about patients that have ongoing pain. Obviously, it reduces the quality of their life and or reduces their ability to work. So it's something that's very effective, and we've had very good results with the patients that have been served in that center.
In this country especially, there's just an epidemic of back pain. So probably about 80% of what we see is back and neck related disorders. This would include sciatica, which is irritation of the sciatic nerve, which travels down the leg and gives you that radicular type pain traveling down the leg from the back. It would include diseases like spinal stenosis, which is a narrowing of the canal inside where the spine sits, very common as we get older. Degenerative disc disease, which is a narrowing of the disc spaces in the spine. So it runs a full gamut of neck and back disorders. Some of these patients are in terrible discomfort. A lot of these patients, the pain is dominating their lives. It's all they think about. They can't leave their homes. they are literally debilitated from the pain. When a patient comes in, I always have 4 generic goals, and I'll discuss this with the patients. The first goal is rather obvious. I want to reduce their pain. The second goal, maybe not as obvious, but maybe more important, I want to improve their function. I want to give them their lives back. You know, for an 85-year-old, it might mean getting out of the house, being able to go shopping, play cards, whatever it is that gives them enjoyment. For a 35-year-old, it might mean getting that patient back to work. Okay, so that's the second goal. On top of that, I want to reduce or eliminate the amount of pain medications that they're requiring. And lastly, if I can, I want to avoid that patient going for surgery. If I can take an 85-year-old with spinal stenosis and treat them with a couple of injections and avoid the operating table, I think I've really done that patient some good.
Most common cancers locate in the womb proper, the uterus. Approximately about 40,000 of these cases are diagnosed and treated annually in the United States. Cancer of the cervix has been linked to a virus called the human papilloma virus, the HPV virus. In fact, we think that there is a cause and effect relationship. The relationship between cancer of the cervix and HPV virus is so strong. There is no risk factor in all field of cancers, oncology worldwide, that has that strong relationship. So women who get exposed to human papilloma virus are advised to have a frequent screening. Cancer of the cervix is potentially preventable as it is now. In the future, we think it can be preventable completely and eradicated, actually. At this point in time, if a woman undergoes pap smears, as recommended by their physicians, and they're properly followed through, no woman should actually die from cancer of the cervix. Now, in the future, oncoming here in the next few years, 2-3 years, will be the vaccine for the virus itself.
Another procedure in the endovascular suite is what we call uterine ablations. It's the opportunity to provide for women who have uterine fibroids an opportunity to take care of those problems without having to go through major surgery.
We're preparing the ultrasound machine. We're putting a camera drape around it. So this is sterile. Can I have a rubber band, please? The patient has a lump in the right breast that is seen on the mammogram and ultrasound, but it's non-palpable. So we're going to localize it using the ultrasound machine. Once it's localized, we're going to put a small wire to mark the place where the lump is, and then we'll do an incision and remove the lump. Can we dim the lights in the room a little bit, please? There, perfect.
See the wire right there?
Yes, perfect. So I'm going to advance the wire a little bit and pull the needle back.
We offer sleep diagnostic services for individuals who have trouble sleeping, to put it as simple as that. And that service is something that really helps physicians and their patients understand why they're having difficulty sleeping.
First, the patient has been, let's say, seen by the sleep specialist, and then if he requires a sleep testing, then we ask the patient to come in the sleep center. They come at night time, let's say around 9 o'clock or so, and we have a sleep technician, which is the one who monitors them. First, he hook up the leads and everything and let them sleep in one of the very homey situation room. They sleep over, and we have a camera which monitors their sleep. All the hookups are connected with the computer. The sleep problems, most of the time, if you accurately diagnose them, most of the problem you can fix them 100%. You'll be surprised. People come with the snoring, stop breathing, choking, gasping at nighttime, couldn't sleep at nighttime, and they feel tired, sleepy, dozy during the day. Once you find out the problem, you fix the problem, they sleep like a baby. They feel like $1 million person next day. You'll be surprised that the sleep apnea per se, it's up to 4% of the population, which is almost more than the people who have asthma, actually. A lot of people have sleep apnea problem, a lot of people have insomnia, they can't sleep, that's a different issue. A lot of people have jerking leg movements disorders called periodic leg movement syndrome, a lot of people have restless-leg syndrome, and a lot of people, as you said, sleepwalking, sleep terror. So yes, these sleep problems are very common around nowadays.
We have a tremendous wound care center, and the wound care center is something that really it's fantastic for patients who have acute or chronic wounds and they've had trouble getting them to heal. and the group of physicians in that center are really dynamic in providing aggressive and consistent treatment and follow-up with those individuals, and they actually have great results.
Wounds come from a multitude of things. The primary thrust of what we do here relates around several disease processes. As an example, one of the big ones is diabetes. There are about 18 million diabetic patients in this country, and about 2.5 million of them will develop ulcerations in their lifetime. So it's about 15% of all diabetic patients. And if you figure that over 1 million new diabetics are discovered every year, that number will increase incrementally. And what occurs in diabetic patients is they develop something called neuropathy. Their feet become numb due to the disease process and the effect on the nerves. Their hands can also become numb, but predominantly their feet. So what that basically means is when they're walking, they will not be able to feel something like a pebble in their shoe. Their foot will be moving around, and ultimately they will develop some callus tissue. The callus tissue will ultimately ulcerate or create kind of a breach in the epithelium or the skin itself and create a defect or a wound. Patients who live in this area are historically over the age of 65 to a large extent, and the patients who are admitted to the hospital are usually in that age group. Diabetes is a very large problem here. Certainly patients in neighboring facilities like nursing facilities are developing, unfortunately, the sequela of the bedbound patient, which is the pressure ulcer. Diabetes is really out of control, not only in this area, but really in the country and also in the world.
In terms of the service growth, we've seen tremendous amount of change in our women's and children's services. We have a very active obstetrical department, having seen year-over-year growth in the care and treatment of moms and their babies. We provide great care. We have always looking for new and upcoming service lines that can be offered to our community. I want to see Northwest continue to grow in taking good care of patients on the inpatient side as well as the outpatient side. We have a growing population of people that are sick and need us, and we want to be here for them now and in the future.
The very interesting story of the Northwest Medical Center located here in Northwest Broward County. As they put it here, the direction to turn for quality care. I'm Doug Llewellyn reporting from Margate, Florida.
Well, that does it for this edition of Close Up on America's Business. I'm Janice Marie. Thanks for joining us. We'll see you next time.